Welcome to Harkle. We'd like to take this opportunity to let you see our parking lot so that you can see the 2 handicap parking spots that we do provide to our patients with ADA access into the building, as well as designated patient parking for those who are coming for clinic visits so that they can be as close to the building as possible. In addition to our patient parking, we also have adequate employee parking so that everybody has quick access into our buildings. From here we will go into our lobby and we'll let you see where our patients can wait for their clinic visits as they come in to see their provider. Alright, so we have moved into the clinic, into our lobby, and what we would like you to have an opportunity to see is that currently we do provide space for up to 10 patients to have ample room to wait for their appointment. And we are in the process of actually doubling that space. Alright, so we have moved around the corner in our lobby just so that we can show you that we do have our notice of privacy practices posted so that patients can see those in both English and Spanish. And then on the opposite wall, we do have all the available providers here at this clinic in both picture form and name listing. For a lot of our patients who may have no phone access, we do have phones available for them to use in our clinic, so that if that helps them access other points of care or just contact their ride so they can get picked up in a timely manner, we do make that available to them. We also, as part of our clinic, have a suggestion box so that if they take notice of something that they want to bring to our attention so that we can improve their experience, we do that. Again, we're going to bounce to the other wall, and we have over here our certificates for our clinic Class B1, our operator's license, and the business registration from the city of Santa Fe. Okay, so we've moved to the opposite end of the hallway, and we're just pointing out here that we do have our client bulletin board where we have our clinic guidelines, our patient rights, our patient responsibilities, and we do post those in both English and Spanish as well. And then as part of our outreach services, we do make a condom bar available so that patients can take whatever they need as they pass through the lobby. All right, so what I'd like to do now is just walk you back like we would do with our normal patients to go through the process of being roomed for their appointments. So if you'll come with me, we'll just head on back. All right, so we've moved down the hallway a little bit further into the clinic, and we just wanted to let you see that we do have a wheelchair accessible scale where we do weigh all of our patients. And then from that point, we move into a more private space, so an exam room, so that we can finish up the rest of their vital signs and then do like medication review as well as allergy and any history updates that they might need for their chart. If you'll follow me, we'll just give you an example of an exam room. So from here, the patient would have the option to start out in the chair, and then if the provider needs them, they would have the exam table available. But in here, the patient has privacy to discuss whatever they may need to discuss with their provider. All right, so we also wanted to make sure that you get to see that we have an in-house phlebotomist who is working with us to draw labs for our patients while they are here in lab. Her area of work is over here on this side of the hallway where she has everything that she needs to be able to do those functions. This is Maureen. Hi. And then as part of that, we do have a bathroom adjacent so that people can use that for any specimens they may need to provide in the privacy of a bathroom. We also have a lab space for our staff when they're running point of care tests so that everything can be kept in a clean environment. As part of the services that we do offer here at our clinic, we have a designated space for our behavioral health therapists who see patients here in our clinic. And so on a scheduled basis, they're able to use this office to conduct therapy with their patients. Okay, so we've moved into a more clinical active area, and this is our medical assistant pod. In the pod we do have our E-kit, which is our emergency medicines if we did have a code situation, as well as our AED if we had somebody who was unresponsive and we needed to perform BLS on, basic life support. I, as the clinic educator, do certify our employees as they need it for basic life support certification at least every 2 years. So we've already taken you into one of our exam rooms, but I did want to point out that currently we have 7 exam rooms with 1 procedure room, and through our remodeling and renovation process we will add an additional 5 exam rooms and several offices for providers. We also wanted to just point out that we do have CLIA waiver, and because of that we are able to perform several point-of-care tests, and those do involve rapid HIV, rapid Hep C, influenza A and B. We do hemoglobin A1Cs. We do pregnancy tests, human chorionic gonadotropin, HCG, in addition to strep and RSV. Okay, so we've now brought you into our medication room here in the clinic. It is a secured area that we can keep locked, but in this area we're able to stock vaccines that are made available to patients, especially our HIV patients, meningitis, pneumonia, Hep A and Hep B. And then we also wanted to point out that for all of our patients who may not have English as their primary language, we do use an interpreter service, and we are able to access various languages, not just Spanish, for any of those patients who may have a language barrier so that they can appropriately interact with their provider. So because we mentioned to you that we had a procedure room, we also wanted to point out that part of our CLIA waiver does allow us to have an autoclave, and the autoclave is used to sterilize and reprocess any instruments that we use in those procedures. We would like to now welcome you to our case management wing, which is connected to our clinical area. In this area we have our community resources wall where we have different items that are available to our clients. We also have a second interpreter for the area over here so that any clients meeting with case management who might need translation services will have that available. When they are meeting with clients, all of our case managers do have a private space to meet with their clients in, and we just wanted to give you an example of one of those offices. So in here they're able to meet with clients and conduct business in a private area. Alright, so we brought you outside to our patio space, and we just wanted to point out that, you know, as part of our clinic and case management areas, we do afford our employees a patio space that they can come out and take a break or have lunch and, you know, interact with other employees just to kind of take a break from the day. We have moved back out of the clinic to the entrance area, and we just wanted to point out that our pharmacy is less than a 1-minute walk from the entry of our clinic to the entrance of the pharmacy. Okay, with that 1-minute walk, we are now outside our pharmacy, and we wanted to take a moment to just point out, with COVID restrictions, we did make curbside pickup available to our patients so that they can come to the pharmacy, and the pharmacy staff will bring the medication out to their car in a relatively contactless manner. As part of COVID, we've also been able to offer free delivery to our patients for those people that can't physically drive to the pharmacy. All right, we have moved over to our pharmacy, and I would like to take this opportunity to introduce you to our pharmacy manager here at Harkle, Perry Mackerel.
Hi, welcome to pharmacy. My name is Perry Mackerel, as Chris just said. We manage a very hectic and very busy pharmacy here. We fill hundreds of prescriptions a day. The team here is extraordinary and focuses on patient care and the patient experience. In addition to really going above and beyond and doing extra for our patients, we also offer free local delivery, we offer free overnight FedEx delivery, and we offer free curbside pickup. We also do pill packs. We spend an extraordinary amount of time making sure that the patients get all the discounts that they're entitled to. Our goal is that everyone gets their prescription filled on time and accurately and has a zero copay. Doesn't always work out that way based on some insurance issues, but the technicians here in the pharmacy are very well versed in the laws and the rules and take many, many extra steps to take care of our patients.
Okay, so we've moved over to our outreach services, and I would like to take this opportunity to introduce you to our supervisor of the outreach services department, Max Avery.
Thank you. So at our outreach and prevention program, what we do is we focus on HIV and hepatitis C testing. These tests are rapid tests where we can give results in as fast as 20 minutes. What we do during those 20 minutes is we counsel the clients on harm reduction programs and come up with a plan to prevent risks in the future. What we try and do is make sure there is something that they come up with the plan themselves so that they can follow it. Seems to be the best approach. If the results are positive, we let them know about all the options that are available, including a Southwest Care. All of our staff is certified and trained by the Department of Health so that we can get them the best test and the best test experience possible.
Okay, that completes our tour through Harkle, and we'd like to take this opportunity just to say that, we've been caring for HIV patients for 25 plus years, and we look forward to continuing in another 25 years of providing that service to our patients. We're proud of the care that we provide, and we'd just like to take this opportunity to say welcome to Harkle.